Hello.
Hey, how you doing?
Good morning.
If you want to
Morning.
hear that again,
I'm gonna grab
ask me to
breakfast.
sing
I'll be
the
right
NASA
back.
song.
Do it.
Hi, everybody.
Hello. Morning.
Morning.
Okay. All right.
All right. Just waiting a few more minutes for people to join. I think for now, if people want to introduce themselves in the chat, just write your name and what organization you're with. All right. I think. I wonder if that's enough. And more people. There you go. Just as I want to start, I think people start joining. Cool. So I think I'll start now, but just and okay. So thank everybody for joining us today, right before school starts or for the majority of our college campuses, school starting next week. But thank you for joining. For those who might not know me, I think I know everybody here, but Juan Cantu, program officer with Boss Foundation, help organize and manage these coaches meetings every month. This month is particularly busy. We're gonna have like we're gonna have a few meetings this month, just since this is traditionally the most needed, I guess, to support for students this month. We're gonna have the meeting today, obviously, and then next week I've sent out you Aspire training on financial aid that everyone should have if they're on the Success Boston list. If you don't, you can send me an email after this, and I'll make sure that I get you the registration link for that training. They'll be U Aspires will be running it, so they're gonna have all the information. I just send the link out to register, and then on the 16th, so in 2 weeks, we're gonna have another check-in with coaches just to go over any like sort of troubleshooting, checking in on what's going on with these first couple weeks of school, checking out drop deadlines, seeing what students are going through, if there's any trends or patterns that we're seeing with students, and hopefully being able to do something about it, or at least learn from some experts on how to help students out. Today, everyone should have the agenda, but we're going to be talking about just general updates. Then we have BPS. We have Marcia and Miss Mitchell talking to us about College Month in October, which for many who have been part of it in the past, it's been this great interactive month where we talk with college, high school students about college and what it takes to get in and different opportunities. And obviously that's not going to be in person. So how soon we're going to tackle that virtually. Then we're going to go over health insurance topics, specifically with the Mass Health and SHIP, which has been a big issue and big roadblock for many of our students in this time right now. So we have Hannah Friggin from Healthcare for All talking to us. And then at 11, we'll have Aleta Quiroz-Livanese from the Department of Higher Ed coming in and talk to us about just overall updates with higher ed and the state universities at the UMasses. So that'll be pretty much it. And then just some next steps. But outside of that, that's what we're going to be doing. And if anyone, and then we can talk about a few more things. But first off, wanted to go over just seeing if there's any updates from organizations that people want to talk about, if there's any folks hiring or any updates around that. Anything people want to say? Okay.
One, it's Kathy. Hi, everybody. Good morning. Nice to see you all. I just wanted to both update and put a plug in for attendance on the 16th of September at the coaches meeting. At the PIC, Kristen McSwain of the Boston Opportunity Agenda and I have been convening the Opportunity Youth Collaborative, which I see overlapping with Success Boston because we define Opportunity Youth as not just totally disconnected 16 to 24-year-olds, but marginally connected. So a lot of our community college students we see as Opportunity Youth, particularly those that are just kind of cycling in and out and not making a lot of progress. So we're mapping, oops, got some interference. We're mapping career pathways with the Aspen Institute, hoping to qualify for a grant to bolster scale in pathways. We're looking at both community college and job training pathways. So on the 16th, we have a researcher who is going to share some labor market data with you guys and some opportunities that they see from interviews they've had. Then they're going to interview you as a focus group on things that you think would barriers and opportunities for graduating more of our students successfully, getting them prepared for careers or transfer more successfully, particularly thinking at Bunker Hill, but also community college in general. So you guys have such a unique bird's eye view of the things that are happening that I'm really excited for the consultant to hear from you what the challenges are and where opportunities might be to strengthen things. So I just want to put that plug in there for the 16th. It's Phil Jordan and Nate Hunt of BW Research will be joining us.
Kathy, what time is that going to be on the 16th?
1.
Sorry, I was muted. I believe it's going to be 11 to 12:30.
Thank you.
We're sharing a Zoom account, so I think people had already booked the earlier time slot, unfortunately. So we got to be flexible in this time. But yeah, it's from 11 to 12:30. And depending on how long Nate and Phil want to interview us or vice versa, talk about, or coaches want to talk about the struggles the students are going through, it might stretch a little longer, but I think that's probably the time slot we're going to have. And I'll send out the information after this meeting. Yeah.
Juan, did you say it starts at 11?
Yeah.
Yeah, I'm the one who booked the Zoom account for earlier, so we can totally like liberate it and use it for this purpose. So if you want to move the meeting earlier, that's totally fine.
All right. So
Let me just make sure they can come to it earlier. I'll do that.
because I checked in with them for 11 and they're open that time. So
They might be open for earlier if that's good for people.
So for now, I think if folks are putting stuff on their calendars, hold 11 to 12:30. But I'll send an update after this. Hopefully by the end of the day, we can confirm something different if it does change. But yeah, I'm very excited about that meeting. I think having seen some of the presentations that they have been giving us and talking about career outcomes and outlooks, especially with students, I think both they can learn a lot from us and we can learn a lot from them. So it's very excited for that too. Thank you, Kathy. And if anyone else has any updates for their org or anything that's going on.
Yeah, I just wanted to remind people that classes do start September 8th for Bunker Hill. But we're extending our last day for add drop is going to be September 15th. And after September 15th, all our offices on campus are going to be remote. That's a change. We did have 25% working on campus, but that's after the 15th, Student Central and everyone will be remote. And December 21st is going to be the end of the semester, and that's going to be the last day to withdraw from classes with a W. So that's a change, just like we did in the spring. Students have until December 21st. And we are just, as of yesterday, going to be offering TEAS testing in our assessment center. So I'll be sending an update out to everybody. I also believe that we're still going to accept applications after Labor Day, which is very unusual for Bunker Hill, but I will send something out to all the coaches in regards to that. You can look at the website, but as our numbers are down, we're going to still accept students. And the classes are predominantly remote. The classes that have labs will be on campus. It's less than 20% of our classes. And they'll all be socially distanced, and all students have to wear, anyone who comes to the campus has to wear a mask. Thanks.
Can I ask a question? Bunker Hill related?
Sure.
Hi, good morning.
Hi.
The telephone numbers that students can reach offices at once they go remote, will those change or will they be the same?
No, they'll stay the same, and we are really beefing up our chat feature. So please encourage students to do the chat, the online chat. And if they're not comfortable, which some students aren't, you know, they can call chat and somebody can call them back individually or something. But the numbers will be the same. The chat hours will probably extend and be more for every department. Okay.
Sometimes it's helpful. I've been doing some crazy times, but I've been in Zoom meetings with students and we're doing speakerphone conversations via Zoom and colleges. And so sometimes it's helpful to be able to just get somebody on the phone to kind of have that three-way conversation. So just in case they get more, that might be why they're getting more phone calls than chats.
Yeah, it's interesting. They said that there's a lot of students prefer phone.
Yeah.
As opposed to a video chat.
Yeah.
Thanks.
Yep.
Thank you, Kate. I know we had some other updates from our partners at RCC and Benjamin Franklin. I don't think they could make it today this morning. Specifically with RCC, they're starting today, starting a little early. The first day classes is today, and the last day for any changes at drop is the 15th of September. So make sure if you do have students going to RCC to have those dates in your mind. With Benjamin Franklin, they are starting next week, like Bunker Hill. They're starting on the 8th. Everything's going to be online the first week. They will have some labs starting the week after that on the 14th. But everyone who is going to be going to campus has to read and sign their return to campus safety guide. So acknowledgement of what is expected for them, and making sure that they're being safe when they return. So if there's anything that, if they don't do that, then they can't return on campus to participate in their labs. So make sure to reach out to Benjamin Franklin and Jackie specifically if the students have any questions about that. I think that
One, I just want to make sure Joel's update is seen, the one he put in the chat.
Oh, I didn't see that. Sorry. Oh, yeah. So Hyde Square. Oh,
or Joel, you can talk about it if you want.
Yeah, they're hiring somebody for their tutoring part time, about 20 hours. So if anyone has any recent grads who are still looking for jobs or just want to do something, maybe they're going to grad school. I think this could be a good option for them. And just ask Joelle about that info once after this chat. So thank you, Tony. And then the last thing was the monthly messages. I think we've all seen them, but just to reiterate on a few things for September, I think everyone is saying, finalizing class schedule, financial aid is a big push this month. Most students, if they've already applied and enrolled, should be they should have registered for all their classes. They should have their financial aid all set up. Sometimes they can't get a few things last minute done. It will be tough. Some community colleges and some 2 years have some mini sessions or classes that start a little later. So that is possible to start after the traditional start period of the fall. But usually right now is when everything is required to be done. So if you have a student who might not be done with certain things on the FAFSA or getting their verification information submitted to the university or the college, it might be a spring 2021 start that they're looking at. But make sure to reach out to the colleges to see what they can do to help out. And I will make sure to send out the monthly messages again in the notes afterwards. But I think that's the biggest one right now. Just making sure people are set up with financial aid. Let's see, and then the next thing. So you Aspire trainings, and if there are no other org updates, I think we can open the floor for Marcia. Marcia is here.
I'm right here, Juan.
All right, thank you.
Good
Awesome.
morning. So good to see everyone today, and I hope everyone's gearing up for a restorative holiday weekend as you all plan to launch your programming across our college campuses. I'm sending good thoughts and energy your way for sure. So October is College and Career Month in the Boston Public Schools, as you all know, and we are really eager to get our students excited about their futures. We have, traditionally kicked off College Month with a day when we all have an opportunity as practitioners to represent our alma maters. And rather than just executing our bragging rights, which we have all definitely earned, this year, we really want students to understand the why behind our decisions and how it has really led us to live purposeful lives, right? Even though, that purpose is, constantly evolving for me, and I'm sure it is also for you, that it is a journey. But saying that it is a journey, but you have to start at some point. So, the why around, why did I choose my major or my career path? And how did that change over time? Why did I choose the college I decided to attend? How do I see those choices connecting to my overall purpose? I know when I speak with students and they find out that I attended an HBCU, it's like a stop, drop, and roll. They want to know, like, how did I make that decision? Why did I choose that institution? And what led up to that choice? And they like hang off of every single word that I say, because it's a whole big story behind my why. But I think, this is a really great opportunity for us to really share from our hearts, given the, everything that's happening in our world. Our students are depending on us to, really inspire them, and they are going to hang off of every word that you have to say, even though you feel that your why is not relevant to you. It definitely could potentially be relevant to another student. So we see these stories as being shared through not only photos, as we have historically done, but through short inspirational video clips. We are enlisting the support of a social media communications expert who will consult with us throughout College Month and help us to coordinate these clips and these photos and ways that we can get this right in front of our students, directly to them through email opportunities or social media channels. So I'm looking forward to that portion for sure. This year, it is very, very important that our students and our families know that our college planning services are alive and well. They're available to them, even in this remote and hybrid space. We plan to launch a FAFSA completion initiative. We will be tracking data with our core partners who are engaged in on a high level of leading FAFSA work across our schools. We want to elevate the application support opportunities that are available to our students and our families. We are also planning to collaborate with the Boston Opportunity Agenda on a shared public will campaign focused really on the goals and the competencies outlined in the college career and life readiness framework, which you are all very much familiar with. And here again, really getting at the why, the what, the how, and getting that into the consciousness of our families as early as possible. They see all these, goals and competencies. You need to be able to set a vision, communicate with others and work with others, and, select a course and change course. But how do you really get there, and what are the tasks, experiences, activities that you as parents or students need to participate in to really achieve those competencies and goals over time? So more information will be coming down the pipe from Krista McSwain around that, and I'm sure that she will then come to this team to kind of share the campaign goals and some strategies that we'll be working on throughout not only the month of October, but throughout the entire academic year and moving forward. We plan to coordinate our efforts again around 4 key themed weeks. The first week will be a focus on college affordability. We know that historically U Aspire has done their financial aid one-on-one workshops. We want to offer our students and families FAFSA simulations as a readiness activity so they can begin their application and pull together all the paperwork needed to successfully submit a FAFSA. We're really pushing for this, particularly given some of the data that has recently come out around the number of students who did not submit a FAFSA in the class of 2020, knowing that the class of 2021 will be facing some of these same challenges, and really, again, the why, the purpose. helping them to build their mindset that this is still doable despite, some of the things that are happening around them, that once this passes, we need you to be settled into a post-secondary plan, and we're committed to walking that road and going forth on that journey with you. So that's really, the message around FAFSA completion, and really getting to the parents, maybe working with many of our organizations around Lunch and Learn opportunities or evening webinars for our families to understand the importance of, supporting their students and gathering some of the paperwork that's needed to complete the FAFSA. And then really, trying to start the scholarship sessions as early as possible throughout the academic year, highlighting some of our local scholarship opportunities that students may not be aware of. And there's tons of them. The second week is really going to focus around college readiness. And CAC will be working strategically with us across all of our schools on engaging students in virtual campus tours and reflection surveys. We'll be working to leverage Naviance, our college and career planning platform, to do some of that work and hopefully track students who are actually taking advantage of these virtual tour opportunities, and maybe doing some type of post-reflection with them and capture that their thoughts or their learnings from those tours. We want to launch a series this week of virtual college fairs or some type of panel structure where it will be focused specifically on answering the questions of our BPS families and students. And we're thinking about 3 kind of themes for how we want to bundle the institutions. We want to have definitely one just focus on 4-year public and private institutions locally. The second on 2-year community colleges, highlighting our tuition-free community college opportunities and really helping families to understand how leveraging that can be not only a great career pathway, but a really good cost savings. And then the third one, which a lot of students have asked for, is an HBCU panel and presentation with some of the alumni, like what do they need to be, and a lot of younger families have asked to, like, what do I need to do right now in middle school to, really increase my child's readiness to access one of these institutions. And we want to make sure that we're giving them all the tools to kind of think about that process. We know that there's tons of national virtual college fairs that's happening. We do have a consultant who's working to pull together all of the virtual campus opportunities this kind of quarter, in addition to any national virtual college fairs, and making sure that we're getting that information to our families for their preparedness and awareness. That week, we are also, as a district, and this, we haven't really sent the memo out to the schools yet because we had to iron out some of the operational components, is we are launching on-site PSAT and SAT school day initiatives across all of our schools, so our students can opt in or opt out of coming to the high school campus to actually take their SAT exam on the high school campus. And we're doing this even though, many of our universities are going test optional. We're doing this, number one, many will still look at that as part of using multiple measures to consider a student for admissions. And number two, a lot of our test centers are filled to capacity, and many of our students were locked out if they weren't, if they didn't take the initiative to plug into one of those Saturday sessions. And if a student student really wants to take their SAT, we want to make that happen for them. So the district is paying for all of those exams. So it will be at no cost to any student, regardless of their family's income. So that's a great opportunity for you guys to say, hey, if you need support with proctoring at the schools, as you know, the high school campuses will be closed during October. They will not be physically back in their hybrid version until November. So it's a little logistical nightmare right now to kind of coordinate across schools on opening the buildings during October, but we are working through the details, and we're happy again to offer that service to our families. The third week will be STEM week, and which coincides with the state STEM initiative, as well as Alumni Engagement Week. So I know that the PIC has historically led a lot of the STEM initiatives. We will capture that work and utilize College Month as a mechanism to really push out really good information on the work that they're doing within their agency, as well as within collaboration with our STEM director in the Boston Public Schools. I know that they're also thinking about how to bring forth internship opportunities through virtual sessions for our students, and will be giving us more information about that. And then the final piece this week that I would really love to enlist the support of Success Boston in is really setting up an alumni kind of panel where students come back and really talk about the good, the bad, the ugly, and the wonderful about their early college years, and just giving students an opportunity again to ask questions and get answers to their most pressing questions. So that is something that Antonia and Juan has raised their hand to really support us and co-host that session, and we can really work together to get students plugged into that. The final week would be success planning with Naviance. As you all know, Naviance aligns with the state's My Career and Academic Plan, which is MyCap. Our goal is still to get as many freshmen, ninth grade students connected to that platform and really beginning their success planning as early as often and often as possible throughout their 4 years. And so MyCap, utilizing Naviance, really will engage students in activities such as, developing a SMART goal, doing a career cluster finder, understanding your learning styles, beginning to build your resume. So we have a series of milestone activities within Naviance that we will be developing lessons around, and the expectation is to utilize that week to really launch this work with your ninth grade students, knowing that Naviance is highly utilized by our seniors anyways because of the college application process, and then by our juniors as they're beginning to think about their post-secondary plans. But the real heavy lift and work across our schools is how do we get this planning really launched with our ninth graders. And so we're going to utilize College Month as, again, an umbrella to really jumpstart that process, knowing that the work that we're doing across all of these weeks in and out of, College Month is going to be throughout the academic year. So I'll stop there. There's a lot of excitement. I'm working with many of our organizations to pull together the materials that will be used to really build the campaign for this year.
Thank you, Marshall. I know it's a lot of moving parts, and we really appreciate you taking the lead over so many different nonprofits and partners that take that do all of this for the students. So thank you for that. I also want to address a couple things on the chat that I didn't read before, but some organization updates. U Aspire is hiring a college affordability advisor, so Karen's going to be sending that link out. And Fina, the College Month is October, so we're going to be doing a lot of work around that time to support high school students getting ready. So from PSAT prep to virtual college fairs, that type of thing, every week is going to be themed, but we're going to get some more information as we go on. So I'll make sure to send some info to you after the meeting. But we are, I think, at our next section, which is going to be with Hannah, who I see is here. Hello, Hannah. Hannah's from Healthcare for All. It's a nonprofit that helps support that space in the city and the state. And she is going to be talking to us a little bit about some health insurance for college students, specifically within the changes within Mass Health, or SHIP at least, and then any information on the Health Connector that she can help us with. And then we're going to have a little bit of a Q&A afterwards, but yeah, give it away to Hannah. Thank you very much.
Thanks for having me here. So my name is Hannah Friand, and I'm the Director of Education and Enrollment Services at Healthcare for All. And as Juan said, we're a nonprofit advocacy agency. So we do a lot of policy work trying to get quality, affordable health coverage for all Massachusetts residents. But what I do is I oversee our consumer helpline, and our helpline helps people enroll into health coverage. I also do some policy work around Mass Health and the other state programs. But I know in particular this year is a little bit different than the last few years with changes to the student health insurance program, which is called SHIP. So in the past, I think it's actually been 3 academic years now, Mass Health has been paying the premium for student health insurance and wrapping the coverage as secondary. And so that means that they were picking up the copays and also covering the premium cost. So Mass Health is no longer going to be doing that. And what that means, yes, it's a big change. So what this means is students can waive the student health insurance if they are on Mass Health, and they would have just Mass Health coverage. They can choose to have Mass Health as secondary to student health insurance, but it's not going to help with the premium costs. It will help with copays, but it would not help with the annual fees. So I know that this is a big change for a lot of people. This was kind of a pilot program 3 years ago, and it works really well for a lot of families I know. And so I assume that this will be a question for many people. And I know we're already getting questions about we've spoken with some students who actually want to get the SHIP program, but also want Mass Health as secondary. And there's been confusion on if they can still have both. And the answer to that is yes. But if you're Mass Health eligible, that does fully waive student health insurance coverage, as does the Health Connector insurance options. So in our healthcare system, the subsidized coverage is all through one application. It's through the Health Connector. They make the decisions for Mass Health and for the marketplace. And so our helpline assists people in applying as enrollment assisters and going through that process. For students, it can be a little complicated because they may still be part of their family's household, or they may be on their own. And so oftentimes that we kind of coach families through that too, because sometimes, it's a 19-year-old, 20-year-old might not be living with their parents or filing tax. They're not claimed as a dependent. And that's actually important to know for health insurance. So I think that in particular, it's helpful to know that there's enrollment assisters actually across the state. And I'm going to put the link in the chat box right now, as well as our helpline. So our helpline is a free resource. And I'll put the 800 number in the next one too, so that people can call, because I think that there's going to be a lot of questions with this change. And we did hear from some folks where it worked better for them to be on Mass Health directly. So I think that this isn't necessarily a loss for everyone, but for people who liked having the student health insurance coverage as well as Mass Health, it's going to be a big change. And just they have the student health insurance line for Mass Health is going to be supported for, I think it's actually probably going away like this month. So they're still there right now and can help explain this transition, but so should Mass Health workers as well. So I'm gonna just put our consumer helpline number in the chat too. So as I was saying about the household, what gets a little bit complicated is for young adults, if they are still on a parent's application, we might need to speak to the parent. So if a student calls us, I would just explain that you might need your parent with you or might need to conference them in, but they can start by calling us so we can see if they have an existing application. We can make updates to their application, or we can create a new application if they haven't applied in the past. There's also, we often get questions about coverage for international students. So international students would not qualify for Mass Health, but can qualify for a coverage through the Health Connector. And if they file taxes in Massachusetts, which they can file at what's called a 1040 NR as a non-resident, they can get the Connector program fully subsidized if they have no income. So they still can get help paying for health coverage. So that's something a lot of students don't know. It's a little bit complicated because they do have to file taxes. So that's another area that if people have questions about that, feel free to send them to us or other enrollment assisters across the state with a website I put in the chat box. And I know international students often are concerned because they might plan on staying and have an adjustment to their status, like going for a work permit or a green card. So we can talk to them about concerns that would affect their immigration status as well. So I see a question in the chat box. For international students, would that include undocumented kids? So international students have a status. They have what's called, it's usually an F1 visa. So they're seen as a resident here, and that's how they qualify for Connector coverage. People who are undocumented can get coverage. It's usually Mass Health Limited, which is for emergencies, Health Safety Net, which covers people at community health centers and public hospitals, or for kids, there's the Children's Medical Security Plan. So there's options there. We can help people with that. They're not able to purchase insurance through the Connector or get subsidies through the Connector, but even with that same application, they can get some help. And so those are the main points I wanted to cover, but I know that usually there's a lot of questions about this. So I wanted to open it up to questions, and I don't know, Juan, are we using the chat box or people, what do you prefer?
I think people are pretty good with just speaking up. I don't think anyone is shy here. So
Great.
if anyone has
Excellent.
questions, yeah, feel free to ask.
I have so many questions. Thank you so much, Hannah, for being here. Okay, so can you sort of like walk us through, so like if I'm a student, last year I had the SHIP, right? I had SHIP coverage.
Mm-hmm.
And now I'm re-enrolling, and I can go ahead right now and waive my health insurance with just my Mass Health card.
Yes.
And then I've been reading, when I do that with students, it says like, this is going to end. And then it says like, you have to choose a like ACO or AOC or something like that, like an associated coverage,
A plan.
something.
Yep. Mm-hmm.
Yeah. So like, do they have to do that?
So yeah, so basically once you no longer have Mass Health as a secondary coverage, you are prompted to enroll into a plan. I don't know that you have to enroll into a plan before waiving the student health insurance. You shouldn't have to, because you still have coverage. But that is actually good messaging, because once you no longer have that primary student health insurance, you'll get a package saying you need to enroll into a plan, and they'll give you, there's like 18 options, but it's usually chosen by who your primary care is or what healthcare systems you want to be in. And there's help with doing that, and they send like a guide with it. One really.
So is that like,
Mm-hmm.
sorry, is that through like, will they just get like an email? Will they get like a packet in the mail? Like,
Packet in the mail. Yeah, so they'll get a packet in the mail. They, unfortunately, Mass Health is not really big on email. The Health Connector sends emails, but Mass Health still doesn't. I mean, it's just, they're just now walking back using fax for like everything. So they're a little bit behind the times. So one important weird factor right now is, so there's the coronavirus, So there's a national state of emergency, which means that anybody who is on Mass Health coverage as of March 18th continues on Mass Health without disruption through the end of the emergency. So what's going to be confusing for messaging is right now people could be all set on their Mass Health coverage, but we don't know when the state of emergency will be lifted and they might need to take action at that time. I'm working closely with the state and a lot of other advocates are to make sure that people get outreach to if they have to renew coverage or if they need additional information. We're particularly concerned about students because their status could be changing on like if they're included on their parents' taxes or they're not, or there's different ages that change eligibility. So an important message is just keep up to date with your mail, basically, which is, yeah, not the best messaging, but yeah.
I guess I'm curious if anybody in the group has had people been able to waive health insurance with just a Mass Health card and not other insurance card?
Yeah, good.
Yeah,
Yes,
okay.
definitely. Plenty of times. In fact, I haven't even seen that you need to select a AOC. I haven't seen that pop up.
Does that vary from school to school? Because I have issues with students all the time where they can't waive their health insurance with just Mass Health.
Yeah, me too, Lydia. Same.
Do you know if they're Mass Health limited and not like a Mass Health? Because there's a lot of one thing.
No, they're Mass Health for sure.
Mass Health Standard or Family Assistance or something. Okay, because that's another thing that people often misidentify what they're on. They might get a Mass Health card,
Right.
so they think they're on Mass Health, and they might not be. So Mass Health Limited doesn't count for waiving school insurance. Health Safety Net doesn't. So there's a few programs that just.
And the Children's Protective one you
Children's
mentioned
Medical
before.
Security Plan.
Yeah, that
it's the
one
other
doesn't
Yep.
either.
Yeah, exactly,
Okay.
because it doesn't cover, like emergencies.
Quick question. Hi, I'm Teresa. So I get confused about that all the time because I waive students' health insurance all the time, especially for Bunker Hill. So I know, is Safety Net under Mass Health?
So it's a program that you apply for with Mass Health, but it's not Mass Health coverage. It's basically, often referred to as free care. It's basically like covering services at community health centers and hospitals. It's not health insurance.
So my question is, the reason why students need health insurance for schools is just in case if anything happens. They can use that to go to the hospital. Why can they waive it for school?
It doesn't cover ambulances even. So, and they have to go to a hospital that's in the Health Safety Net network. So it's just, it doesn't meet criteria as being health insurance because it's basically like a waiver of bills based on income eligibility at certain locations. I hear you though, because they are able to get certain services, but still it doesn't count.
It's I mean, I don't know. To me, it's crazy because the health insurance for school is a lot of money for Bunker Hill, even for like community college right now is like $3,000. And the chance of students going to the hospital, I mean, there's a chance, but it's very low. It doesn't happen. So I feel like for me, it's really, I don't know, it's hard to accept that some students can't even go full-time just because they don't have health insurance. They can't afford to pay the $3,000 for community colleges, even higher for a 4-year school, even when they have something. I don't know.
Yeah, no, I hear you. And I agree. But unfortunately, that it's Health Safety Net, it's just not counted. And it's not necessarily fair.
I think that's something where we can try to do something with policy and pushing folks who we know in that space about what Teresa was saying with students who want to go full time to college, and even if it's a community college, which is much more affordable than some other institutions, that health insurance fee is
a lot.
Stop them from going full time and then graduating on time. That just delays a lot of things. I know. Sorry
to interrupt. That earlier conversation about the Mass Health card being enough to waive at some schools but not others, do you think there may be a sort of an institution-specific issue here? Maybe a college or a university doesn't read the guidance on this in the same way as others or in the way that they should? I mean, if we can identify patterns like these, then we can, like, we know where to act so that some students don't run into issue while others don't.
The other thing I wonder too is if, you know, for the safety net students, if there might be some sort of less expensive patch insurance that could cover the ambulance and, you know, in terms of policy, so it's not as expensive. And maybe there could be scholarships for covering it. Maybe in some cases the student could cover it depending on the cost.
One thing I want to add about kids that are undocumented, we often hear people say that they don't have a status and they have a pending status. If you even have a pending application, you get real mass health coverage. So it's really important, just messaging wise, to make sure people say that if they have a pending application, that they can get greater benefits, and that would waive them. That's, we see that all the time.
Hannah, Sarah, good to meet you. I often think that the work that we do to support college students is like so complicated and confusing at times, but you win hands down. And I'm so grateful you're doing what you do. I think it might be really helpful to just have a line of communication from you all to us somehow to let us know whenever that national safety emergency gets changed, then we could kind of message out to our students and reach out. So that would be helpful to know. And then the other thing I would say is the cost of college health insurance really varies from college to college. So, you know, Simmons is $4,700. And in terms of advocacy work, it would at least help students if there was, you know, a standard fee for that that doesn't vary by institution, because that would make things at least more predictable, just if anyone's thinking advocacy work.
That's helpful. Yeah, and I can see if I don't know if Juan's the right person, or but I can definitely keep you guys updated on when the state of emergency changes. Right now it's through, I think it's October 22nd. Unfortunately, it's a determination made by the feds, and the last time it was made on the last day that it was about to expire. So don't expect to have that until late in October. And it gets basically renewed for 90-day increments. Yeah.
Yeah, you can email me and I'll make sure to let the community here know about that. But that is unfortunate that it's very last minute to hear about that. That's even more imperative to know about our October as College Month will also include health insurance updates. I don't know if there are other folks who have any questions or
I had a question, but I don't know. It may require having to go into more detail. But I was just kind of wondering, like, what for the students since it's COVID, for the students who are taking the majority or all of their classes online, with them still having to pay
Right.
for health insurance, how does that apply
What
to
I
them?
think,
I can understand, like, if a student has to go on campus and they slip and fall, okay, they're covered. But like what they're paying for, what do they get? Like, what do they get out of it if they're just doing 100% online class?
right. I think, I don't know, but I think UMass is not doing that. Because I try to waive it for a student. I don't think UMass is requiring for students to waive health insurance for at least
Yes, they are.
semester. They are?
Yes, 100%.
Wow.
Maybe your students are full-time, but all the full-time
Yeah.
kids at UMass, yeah.
That's very
crazy.
interesting. So I noticed in the chat that there's a lot on undocumented kids and how they really take the brunt of this because the coverage that they get is not, counted as being meeting the coverage guidelines. I will say that Healthcare for All has been doing advocacy to try to get Children's Medical Security Plan to be, to have basically all kids have like mass health level coverage, which would be then extending it to undocumented kids, obviously, too. So that is something we're working on indirectly, but I mean, it takes legislative action, unfortunately. So, yeah. So I don't know if there's any other questions for me.
Think that might be it for folks, but I know would it be possible to, because I know sometimes people prefer to email. People can email me some questions and I can connect with Hannah, or if you feel comfortable sharing your contact info with our group. I think there's going to be a lot of things that come up during this month and even next semester when students are enrolling.
Yeah, I just put my email address in the chat feature. Yeah.
Thank you, I appreciate it. Yeah, so you can either email me or Hannah about these questions that come up after this. I know often folks are a little more hesitant to talk, but can share a little bit more information via email. So
yeah, and if you have like a specific cases too, then I can help with that too.
Thank you so much. We really appreciate this. I know I personally was reaching out to Mass Health, and like you were saying that they don't have an email. I was calling them, calling SHIP, and I was getting to like one level and then sort of tossed aside. So I think if that's what I'm feeling, the students who don't have any experience with any health insurance before this would be even more lost. So we really appreciate what you're doing and the support you're giving us at least. So thank you.
Happy to help. And I'll just say, so the enrollment assisters across the state and our helpline help call Mass Health. So when people are running into those barriers, we can do conference calls with them to Mass Health too.
Awesome. That's really great. That's really useful. But thank you, Hannah. And yeah, hope you have a great rest of your day. Thank you. All right. So next up we have Elena, but I think she's not joining us till 11. I think she was booked pretty late. So we do have a few more minutes till then. I know there's something on the chat that I saw. No, I don't think so. But so I think we can take maybe a 2-minute break if people need to grab anything. And then hope at 11, we'll be back with Elena and get some updates on higher ed.
Can you hear me by any chance?
Yeah, Elena, hi. We're
Hi,
taking a couple minute break just to make sure people are hydrated and got food in them. Because we started at 10.
Perfect.
So, had a couple sessions, and then at 11 we'll start with getting some updates from you. Thank you for joining us.
Yeah, no. Early because my headphones aren't working the way I wanted them to, so at least there won't be any technical difficulties.
Yeah, it's always an issue, right? It's always like, why doesn't everything work? And I always feel like if we're dealing with these things, the students must also be dealing with it, and makes me hope for the best for them too. Let's see.
And for empathy, right?
Mm-hmm. Mm-hmm. think people are slowly coming back. See when people start showing themselves again. So quick update before Elena introduces herself for those who don't know her. I think most of us do, but Kate just put in the chat about some ELL and Learning Community Seminar courses and classes at Bunker Hill have been changed to a late start in October. So keep an eye out for that email later. Because that's pretty big with all first-year students needing to take an LCS. So that's very important.
Yeah, it's mostly ELL, but talk about things changing daily. I'll certainly forward you if you have any students in these classes.
Exactly. I think that's why it's really imperative to have that meeting in a couple of weeks just to check in with anything that's happening this month as things are changing every day, every week. So we'll probably be a lot of differences, a lot of updates the 16th as well. But I think we have everyone or more or less the folks back. So Elena, you can take it away. Do you want to share screen or anything, or okay, cool. So I'll,
If that works. Hi, good morning, everyone. How are folks doing today?
pretty good. Myself, at least.
It's okay if folks also aren't doing good because there's a lot going on right now. So I'm okay. I'm not quite at good, but I'm all right. Like, you know, things are happening, lots happening in the world, but really appreciate all of you being here. And Juan and I were just talking about technical difficulties and really kind of putting things into perspective. I couldn't use my headphones and Juan was like, well then imagine how our students are feeling. I'm originally from Miami, and Miami-Dade County Public Schools opened yesterday virtually, and nothing worked. Students could not log on, teachers could not log on, websites weren't working. So it was a rough first day for students in K through 12 here in Miami, and that's just kind of the way the wind blows, but really kind of focusing on how can folks in higher ed be really empathetic to what's going on with all of our students, and really being understanding. Seen some horror stories on social media about faculty. There's a student who said, hey, my Wi-Fi crashed and I was taking the quiz. I only got through 7 out of the 10 questions. Do you mind, you know, just quickly reopening it? I think I could do better if I actually finished. And the professor wrote back, get better Wi-Fi, which is just like one of those things where we know that our faculty within the public system of higher education will not be like that. That is just not the way that we operate within our system. We really focus on being student-ready colleges and universities, especially now during a global pandemic, as well as just multiple racial crises that we see happening in our country. So really meeting our students where they are and providing them with different ways to be successful in this remote environment. And so I'm happy to say that that was not one of our faculty, because our faculty know better, and they've really been encouraged, like I said, to meet students where they are. So Juan asked me to just give you an overview of where things stand with higher education in the Commonwealth. I know that you work mostly with students who are in Boston Public Schools, but I thought I'd just go broad, and then if you have any questions, I'd be happy to try to answer them. I can imagine what it might be like being in your position. Every school, whether it's K through 12 or it's higher ed, is doing something different, right? Like it's just not consistent, and schools are doing what they feel like is best to maintain the health and safety of their students, faculty, and staff. So I do have a slide that I've prepared just to kind of, like I said, give that broad overview. And if you have any questions, just feel free to chime in and let me know. I can't see all of your beautiful faces when I'm sharing a screen, so just jump right in. So this is just, again, broad overview for fall 2020 semester prep. I will say that since things started happening back in the spring, institutions already had a mind about what they're going to be doing in the fall, right? And when I talk to presidents right now, they're already talking about the spring semester just to give faculty and staff and students a sense of what's coming within the academic year. We're really not in a position, especially if we're being student-centered, to make last-minute decisions, if you will. We had to make last-minute decisions in March because this was an emergency, but really trying to give students a sense of predictability about what will be happening in the future, not just this fall, but as well as in the spring semester, so spring 2021. Just a quick raise of hands, like who had a summer, did anyone take a break this summer? I can't even believe that it's, September 2nd. And that's kind of how I feel about everyone. It's just August came and went, July came and went, and all of a sudden, schools have already, higher ed schools have either reopened or they're going to be reopening shortly after Labor Day. Many of them already welcoming students back to campus. I'm happy to, not happy, but the one positive side of this is campuses that are really focusing on testing, the positive rates have been really low. So they're doing rapid testing. There is not, I have yet to hear a case where students are saying, I can't even get a test, I feel like I'm symptomatic. Everyone is able to test. So those that are coming on campus are testing, and then anyone afterwards, and then there will be regular testing. But in the meantime, if it isn't within the testing period, if a student feels like they want to test, they're able to get a test, which is really, really important to maintain, once again, the health and safety of all of those folks that are attending a residential institution. So for the most part, community colleges are remote. They are still offering a few courses in person, and again, adhering to all of the guidance that has been provided by public health experts, but the majority of courses will be offered in a virtual format. The state universities, they're a little bit different in the sense that they are welcoming students back on campus. They do have residence halls. They are not populated to capacity. It is a much smaller percentage of students that are living on campus this academic year. And again, really robust testing that is being done through a group of institutions, which is great. And they're able to get those results really quickly. There was a concern that, they would have to wait 6 days to get test results, but that is not the case, just given the way that they've approached this work. Even though students are living on campus, the majority of courses are still offered in a virtual format. And then there are a few hybrid courses as well, but again, almost everything is remote. And I would say the same for UMass. They started welcoming students back, with the exception of Boston, earlier this semester, and then going into the next few weeks. Most classes are virtual. Again, a few hybrid courses, just depending on the major. There are some things that are really hard to do virtually, but then those courses that are in person, following all the health and safety standards. And typically these are courses where those students are already familiar with them. They're wearing lab equipment, they have PPE, they know how to keep safe social distancing, because that's just the way that labs in general operate. You're not, using a Bunsen burner right next to somebody else, because that just wouldn't be safe. I don't even know where Bunsen burner came from. I haven't taken chemistry since like 10th grade, but I'm glad I just kind of pulled that right out. And really interestingly, I think like technology has really caught up. I was in a virtual simulation of a lab, which was great. Students were able to just simulate what it would be like to be in a lab environment. One student was in a fire in the virtual lab, so they kind of had to figure out like where the extinguisher was. So I mean, it was very lifelike, and then the lab told them these are the things that went wrong. And then they were able to kind of course correct. So technology these days is really, really lifelike in many, many ways, which is incredible. We also, in this state, as you know, have a number of independent institutions. There are more than 90 of them in the
Oh,
Commonwealth.
yeah, just doing
And they're just all kind of doing their own thing, but again, really working with one another, working with their community to make sure that students that are being brought back on campus, and not all of them are bringing students back on campus, but those that are really kind of taking the community in mind as well. And I would say that for both public and private institutions. As we know, students who attend post-secondary don't always live in residence halls. Sometimes they live at home with families. Sometimes they rent apartments or houses. So our institutions on the public side have been really working closely with local boards of health, local officials, even the landlords, to make sure that there's a community effort to keep not only the students safe, but the community safe as well. So that's kind of just like the repopulation conversation. We never really, we're trying to stop using the phrase reopening because we never shut down, right? Like our campuses were still open. We had folks that were going in there every day, really making sure that the properties were being maintained, that IT was still working, that the servers were up and running, that payroll was running. For some reason, we are all still operating with a lot of paper mail. So those things all had to get addressed. So we never shut down. We just ask students not to come on campus. So it's more about kind of repopulating than it is reopening. And so, like I said, testing, everything has been really encouraging so far, but we're focused on not just the beginning of the semester, but the entire semester and making testing a regular thing. I think the biggest, it's anywhere between every week to every 2 weeks. And again, if you feel like you're symptomatic, you can go ahead and get a test and that'll be made available to you. And there is housing for students that need to isolate. There's communication. So just so you get a sense of how we operate, we had back in March phone calls every day, 7 days a week with folks from the community colleges, state universities, UMass, as well as the independent institutions. We're now down to 3 days a week, but we still talk regularly as a higher education system of both public and private institutions to share what's working, what's not working, where can state government be helpful. We also have bi-weekly phone calls with the Department of Public Health, where we get to talk to one of the state epidemiologists and ask them any questions. And this is available to anyone who is in higher ed. We have presidents and provosts on the line, as well as healthcare directors, faculty, and they ask really great questions about just how things might work on a campus, from HVAC systems and what's, how does air need to be filtered in a building, to how do we get more access to PPE, to the, what is the frequency of testing that needs to be done in order to keep folks health and safe. So there's no shortage of communication, I think, at this point among higher ed institutions, among themselves and with the state as well. There are some national lessons learned. Here in Massachusetts, as many of you know, we kind of start post-secondary a little bit later compared to the South, where they've opened earlier in August. Some institutions had to shut down because of outbreaks. One thing that's really interesting, at least about the public institutions, is that we don't have necessarily the same demographic or the same setup. So for example, many of those schools had a really robust sorority and fraternity life. Our state universities don't really have frats and sororities. Like that's just not a thing that we have. So that's not as much as a concern. And we also, most of our state universities, our students are from our community. So it's not like these are, I went to the University of Florida, they welcomes back 52,000 students on Monday. Our schools are not that big. Our schools are much smaller. I would say that they're right-sized in order to really kind of serve their community and their region. So we're not talking about schools that have 30,000 or 52,000 students. We're talking about schools that have, less than 15, 10,000 students, and a much smaller number of those are coming on campus. So really been able to kind of compare about like how size plays a really big role in preventing outbreak. And like I said, we don't have those large size institutions. Our biggest, for example, UMass Boston, they're virtually remote this summer or this semester. And I think that's in part because of the size, but also it's in a heavily populated urban area where students who come on campus rely on public transportation, and their levels of exposure were probably just going to be much higher than anyone really would have felt comfortable either exposing those students or then exposing faculty and staff. So folks really kind of took a regional approach as well. It was like, what are things looking like in my region? Does it make sense to reopen? I know in Boston, the city's been really involved, and even there's a staggered start, if you will. So one of our institutions thought they were starting at one point, but then after talking to other sister institutions, they delayed their start by 2 weeks just to kind of see how things were going and to make sure that the city wasn't then going to be further compromised by inviting more students back to campus. And then we're planning for the unknown to the extent that, you know, you don't know what you don't know. The way that we see it, we're hoping for the worst or hoping for the best. This is being recorded, so let me get it right. We're hoping for the best, but planning for the worst. So when you look at the plans that campuses have, each of them had to develop an internal control plan that was specific to COVID-19. And that has so many different layers and elements that it's basically like every scenario that we could conceive of based off of what we know. There's a plan for it, and there's not only a plan, but then there's very detailed ways of how to execute that plan. So everything right now is all up to monitoring, right? Like we just need to continue to monitor the situation and see what things are like. But the idea from a student-centered approach is faculty have received a ton of professional development over the course of the summer. To really be prepared to teach in a remote environment, in a virtual environment. This is no longer that emergency situation that we had towards the end of spring. They had more time now to prepare and develop syllabi in a thoughtful way that really kind of met students where they are given the pandemic. We continue to offer any type of technical equipment that students might need. I think all of the institutions really stepped up in kind of providing students with laptops, and MiFis or, you know, local Wi-Fi. Parking lots remain open in case that's just a necessity, but really kind of understanding that this is not the scenario that most students signed up for when they enrolled in post-secondary education, and really trying to make sure that we're not just talking about teaching and learning, but the whole student. So we've started to have conversations with our colleagues around how do we make sure that we're monitoring and promoting mental health for our campuses. A lot of students are dealing with isolation if they are living on campus or they're at home, and it's not always conducive to studying. So really, again, just trying to practice empathy and look at the whole student. So not just the teaching and learning, but what are other things that they might need in order to be successful, which we shouldn't be doing just during a pandemic, right? Like we should be talking about the whole student at all times. One concern that we have is that nationally, we are seeing Black and Latinx students not enroll in post-secondary at the same rates that they were prior to the pandemic. The state has launched a racial equity agenda where we are focusing on Black and Latinx students and their success in post-secondary, really, you know, starting to value the cultural wealth of our students, start seeing them as assets, and builds off of the good work of places like Bunker Hill Community College and their Center for Cultural Wealth and Equity. So we're a little bit concerned about what the long-term implications of the pandemic are going to be for students of color that are not enrolling in post-secondary, whether that be public or an independent institution. It's somewhere where we really need to make sure that that disparity doesn't continue to grow. And I think this is where places like Success Boston really play an important role in encouraging students that are currently in high school or that are starting to transition to post-secondary, that those plans play out, and that those students feel supported. In our state, you really need a post-secondary credential in order to tap into the workforce and make more than a living wage, to make a family sustaining wage. And so we don't want to see the cycles of poverty, which we've been really trying to tackle to break those cycles, continue to play out for the current generation because of a pandemic that we just stopped paying attention to. How do we support students of color? Because we started paying attention to the virus. They're both one and the same. The virus is disproportionately affecting communities of color. So how do we make sure that that just then doesn't play into perpetuating the disparities that we really can no longer ignore? So with that, I think someone raised their hand if they want to jump in. I'll stop sharing my screen and we can just have a conversation.
Thank you, Lana. Yeah, if any people have any questions, yeah, feel free to jump in. Oh, Sarah?
Hi, thank you for this great information. You were absolutely right at the beginning, what you said about we have so many students in so many different institutions and everyone is sort of doing different things. And I wonder if you can help us think through how best to support our students' mental health and safety. And it's something that obviously we should have been doing more of in other times, but I'm really worried about my ability to get students the information that they need to get the support that they need. I feel like I need to become an expert in 50 different institutions, and I just don't have the bandwidth to kind of do the research that I would need to do to establish those relationships at individual institutions. So I'm wondering if there's any sort of state level resources or support that I should instead be kind of focusing my efforts on or sharing with students in order for them to, you know, in an ideal world, I would love all of my students to preemptively get signed up for some telehealth and like get it all situated so that it's on their calendar regularly now. But I don't know how to do that. So just wondering from a centralized standpoint, what you think and how you might advise us to proceed.
So we met with the Department of Mental Health last week to have this very conversation. And the way DMH services work, you have to meet eligibility criteria in order to be eligible for those services. But what we've asked and what we hope to have live, I would say no later than the end of next week, is on our department's coronavirus page, a list of resources for students, family, and then administrators on campus. So really kind of just collating what's available. So to like kind of answer your question about it's different everywhere, like what are the state level resources and then how can folks access those? It was an over hour-long conversation, so it'd be kind of hard to just share everything that we had. But that was really what we kind of took away is we need to get things in the hands of folks that are working with students. So somewhat related is getting training for our residential advisors for those students that are living on campus to really kind of start operating. And they're first responders. They're seeing students more than faculty and administrators are. They're living with those students. So kind of giving them the tools that they need to kind of check on students' mental health and say like, maybe there's something that we could do to better support you rather than waiting for a student to basically be in crisis, which is what we want to avoid. But that's for students who live on residential halls. So there's going to be a series of other resources that would then be available to the majority of our students who will basically be virtual and living at home or wherever it is that they will be residing. The other place where we're also focusing on mental health in particular are students who don't have stable housing. So there's a number of pilots that we have across the state that are looking at really providing those students how, like in the Boston region, it's the K House, which has housing for students that go to Bunker Hill, Roxbury, MassArt, and I believe UMass Boston. So there are about 11 students there, and trying to figure out how do we provide those students with mental health resources as well, just to kind of make sure we've learned so much, like we don't need to re-traumatize anyone. So there, it's also kind of not just broad, but looking specifically at the student population that we're targeting. So for example, you can't just send an email to everyone saying the residence halls are shut down for students that are housing insecure. That was their housing. They needed to stay there. And while we did keep those rooms open for them, there was a moment of panic for those students about like, where am I gonna go now? So I think we've learned a bit from the spring, but again, we'll have those resources up no later than the end of next week. And Juan, I can send that to you and Antonia if you wanna share that with this group.
Definitely. And I think Emily had a question on the chat. Sorry if I interrupted somebody.
I will send you, I'll put my email in the chat and I can connect you with the folks at the department who are working on that initiative. I don't want to misspeak on their behalf. And they're the ones that are really working with that student population and hoping to learn from the pilot and expand.
Awesome. Thank you. I know we have a couple more minutes, but if people do have questions, it's time to ask right now. If not, then I think end pretty quickly. But yeah, and as Elena said, her email's there, so if people do have questions, we can always ask her. And I think you also mentioned the schools not reopening because they were always open. I want to shout out all the IT people who have been keeping this type of stuff going. I know at TBF we have our IT folks going in kind of frequently to the office, and they've been able to help us out. So do want to shout out those people and any of the students who are going to be entering that space. They're lifesavers. But yeah, I think that is all we have for this.
Awesome. And I saw that Kathleen just said that she's a single point of contact for K House at Bunker Hill. Thanks for adding that information. I think they also have an orientation coming up, which should be pretty exciting. Kathleen probably knows more about that than I do, but glad to see those threads are being connected as well.
It was awesome.
And shout out to the IT people. They are holding it down. The orientation was yesterday. I can't wait to hear more about it. I'll check in with my colleagues.
Awesome. Well, thank you, Elena, and thank you everybody else for joining. This was recorded, so if you do want to go back and listen to anything again, we'll be able to send that out a little bit later once everything is downloaded and segmented. But I will see a lot of you next week at the US Fire training, and then the week after that for a check-in during ad drop. Stay safe, everybody. Hopefully you have a little bit of a restful weekend this Labor Day, and let me know if you have any questions. Thank you, guys.
Thanks, everyone.
See ya.
Bye.
Thanks.